delighted today to be joined by Dr. Theresa Burke. She is here in our studios, and she is the founder of Rachel's Vineyard Ministries and part of our team here at Priest for Life. Theresa, so good to be with you.
It's really good to be with you today, Father.
We are both always traveling, and you more internationally than I do, and we want to talk about that a little bit. But because of our constant schedules of traveling and presenting this beautiful message of healing that we're going to discuss, it's not as frequent as we would like for us to actually spend some time here at Priest for Life headquarters, and especially doing these tapings. So this is particularly valuable, and I remember we did a series of tapings, you and your husband Kevin Burke, of course, whom our viewers know as well. We were together down in Texas some years ago, and we did a set of training DVDs.
The Pregnancy, Loss, and Unresolved Grief series.
Yes. So, and that continues to be a resource to people, although I know we're working on updating that. But let's go back to the beginning. Tell our viewers that aren't familiar with you about your own professional training and background. We say Dr. Theresa Burke, but tell us what you specialize in.
Well, my degree is in counseling psychology, and I started out with a master's degree in that. But honestly, I wrote Rachel's Vineyard before I had a PhD, and I wanted to be able to open doors to it. And my background before I went into psychology was actually theater, which is why Rachel's Vineyard is so unique. There is not a program out there like this, because I was drawing from trying to help people express emotions, which is something you learn to do in theater.
Right.
And you use actually a lot of props and music and lights, and so there's the script of Rachel's Vineyard is actually like putting on a play.
Okay.
And so, but the main actor, of course, is the Lord Jesus, our divine physician, who is not scripted in there. And he shows through the power of the word and by putting ourselves into the word. And people have a very dramatic, visceral experience that no one can take from them of the Lord. Even if they had heard the same scripture many years or they heard it for the first time, it's an experience of God touching their soul. And the sheep know the voice of his shepherd. So I never have apologized for a Christian program, because I feel that people intuitively and instinctively respond to their Father's voice when he touches them in that deep place. So it's an interesting background, but I did go into psychology, and that's when I realized there was a problem in the psychological world.
Yes.
Aside from being pro-life for many years and working with a youth group where we were educating them and showing the movies. Father Paul Marks was a friend of my parents, and he used to come by our home, and he used to bring boxes of books and videotapes and movies, and that's where I saw The Hard Truth and Silent Scream and things like that. So I was just showing my youth group. I had all these free resources. He could drop off boxes and all this literature. So that's kind of how I got started in pro-life. And
did those videos really make a profound impression on you?
Father, they did, because it's so hidden from view what this actually is, and to see like the silent scream, and I know that they were not with the technology that we have today. There's nothing like the ultrasounds we have today, but it made an impact on me and our youth group, and we all felt compelled to action.
Do something.
We have to do something. This is all the friends. And there was another interesting thing that happened, because I was doing this youth ministry for 15 years, and there was actually a survey in the Archdiocese of Philadelphia, which is where I'm from, and they wanted to know what was the biggest trouble for teens that they wanted help with. And the number one answer, which floored everybody, was help for my friends who have had abortions.
That was the number one answer.
This was in the 70s, you know, and all the teenagers, their friends were going down, they were having abortions. It was a secret. They were drinking and drunk, afterwards. The aftermath was seen among all these teenagers, so much so that in a survey of what the most important issue, which to me I would think maybe parent-teen communication, or, you just don't know what the topic would be of such concern, but it was help for my friends who had abortions.
Isn't that something?
So I had that in my mind. Well, we better learn more about this issue
Yeah.
if this is what teens are saying. And with Father Paul Marks coming into our home and leaving the materials.
And for those that don't know, Father Paul Marks started Human Life International, which is still an active pro-life group around the world. But that really became...
he was a pioneer. He was probably the first pioneer to do like what you're doing.
Right.
He was really out there, boots on the ground in a very simple way, but he made the rounds through the world, really.
He did.
He traveled everywhere.
So you had this background in theater, and you were awakened to the abortion industry, youth ministry, and then...
I was
the
studying
study of psychology, and then abortion intersected with that in an unexpected way. Tell us about that.
Well, it sure did. There were many unexpected ways, but probably the first one, and that a lot of people will hear because I share this many places, but that my first assignment in running a group, aside from a youth group, a psychological group, was for eating disorders. So my patients were anorexics and bulimics, and the subject of abortion came up one night by a woman I'll call Debbie. And Debbie was having nightmares and flashbacks to her abortion. And she said these memories and images were hard enough, but that her ex-husband would call and leave messages on her answering machine where he called her a murderer. And this is before cell phones, so a message comes into the house, everyone hears it, and she had 3 children at home.
Oh, no.
Devastating for this poor woman. And she was overwrought with despair and grief, and he knew the emotional trigger was this abortion. It could drive her to not only despair but to self-destruction, because she would become so overwrought that she took a razor and she slit her wrist. This happened a number of times, and she had just gotten out of the psychiatric hospital. Her wrists were still wrapped with gauze, and she came to our meeting and she started telling the story. She shared just what I told you about the messages, and she could barely say one more word before a woman in our group said, "Your husband's a horrible man," and all the women nodded their head. And she said, I had an abortion too, and it would just kill me if somebody kept reminding me about it. And then another lady stood up and started cursing and swearing, and she said, "We have a right to control our bodies," and cursed off anybody who should try to make her feel guilty about abortion.
Okay.
And then there was another lady who got up and left the room, slammed the door, and honestly, I heard her car screech out of the parking lot.
So this set off an explosion.
Bomb.
Yeah,
It was a bomb. And you knew I'd be a great therapist someday because I showed a lot of therapeutic insight. I called that girl that left and I said, "Are you okay? You seemed upset." like who wouldn't have seen that?
Right.
Who wouldn't have seen this bomb?
Yeah.
And then when you're a student, of course, you have to go to your supervisor. My supervisor was a psychiatrist. I had to tell him what happened. He leaned in, Father, and he said, "You have no business," shook his finger, closer than me and you. "You have no business prying into people's abortions." He said, "Abortion is a private, personal thing, and I was instructed not to bring it up." And I said, "But I didn't bring it up. Debbie brought it up.
Yes.
I think she has PTSD.
Yes.
And he said, "Her symptoms are a psychotic reaction caused by her medication."
So this has always fascinated me. Of course, I've heard you tell the story many times. We've talked about it. But let me probe into this a little more. And I think many of our viewers and listeners will see right away the absurd thing you were being told and the absurd position you were being put in. Because this eating disorder group, now you were a student of psychology.
It's my first field placement. It's like an internship.
Right. So doesn't this mean by definition that you go in there with a clean slate? In other words, you're not going into the group
to create a problem.
to create a problem, nor are you going in with any preconceived notion or agenda. The idea is listening. Isn't listening one of the most fundamental and important dimensions of counseling?
Well, sure, and especially with addiction. And
right. So it's what the person says that matters.
And it's not what you're eating, it's what's eating you.
What's eating you.
We try to uncover.
Right. So for this supervisor who was a psychiatrist, to hear that a subject came up of deep pain, not just for one, but for several members of this group, And then to say, this is off limits to discuss. It seems to me this is, I'll use the word malpractice, is professional malpractice to say, oh yeah, well, we're going to counsel these people. We're going to try to get to the root of their problems. We're going to try to help them see what's going on in their lives. But if it comes to this topic, don't even pay attention to it. I mean, that doesn't make any sense.
Well, especially when women's experiences were so powerful, because what we're seeing here in this group was textbook PTSD with the fight, flight, fear, freeze mode of trauma. That's actually a trauma response when you can't talk about it and the subject's so painful that you have to run out of the room. That's called the flee response.
Yeah.
It's a response of trauma. When you get so angry because you hear that word, and that one woman that was cursing and swearing, she actually inhibited any meaningful discussion that we would have had about women's feelings, which is what the group is for.
Yes.
Because her rage shut down the conversation.
It shut it down.
And she moved from the emotional experience that Debbie was suffering, her tears, the nightmares, the flashbacks that she had already had and was telling us about, to this, I'm going to shut it down and I'm going to defend abortion rights rather than listen to you. And I think we see that all the time.
Exactly.
And I think when we see the rage in the media, the complete inability to have an objective conversation where people are allowed to share feelings, and even in the Silent No More awareness campaign, when the women get up and give their testimonies, every year you and I both know that you have pro-choice women shouting them down.
Trying to silence them, yes.
They have megaphones.
Yeah.
They want to make it so you can't hear what they're saying because it's so threatening. And why is it threatening, Father? It's threatening because it pricks the conscience that's unsettled about this. Therefore, we can't allow a discussion. They don't want to see a woman regretting it.
Right.
They don't want to see somebody crying about it, or even published literature that clearly demonstrates the detrimental impact of abortion, because the literature is just really fraught with all sorts of disturbing statistics that this is dangerous.
And I want to get into some of that with you a little bit more. But for those of you that are just joining us, Father Frank Pavone here of Priests for Life, and we are with Dr. Theresa Burke, founder of Rachel's Vineyard Ministries, a worldwide ministry for healing after abortion, and she's a member of our Priests for Life family of ministries. So, Theresa, so many things here that you're bringing up. Trauma. Now, you mentioned PTSD, post-traumatic stress disorder, and I know that that's defined with a number of very specific characteristics. But let's look at trauma itself, because this is your field of expertise. What is trauma? How do we heal from trauma? Define for us what a traumatic event is.
Well, it's an event that happens outside the normal everyday experiences, and it usually involves the threat to someone else's life, or witnessing the death and destruction of someone else. And so abortion clearly falls into that, because a woman is undergoing the unnatural. And when I say unnatural, it's not what nature designed for the pregnancy.
Right, it's being imposed.
There's an invasion inside her body that many women describe as deeper and more as traumatic as rape. And there's so many ways to look at this, but the symptoms of trauma, not every woman experiences every symptom, and some can have a delayed onset. We know that there's risk factors for immediate distress and traumatic reactions when there's been a history of sexual abuse, because then the abortion itself is a traumatic reenactment of a violation in that sacred place of a woman's body. And the other symptoms are like hyperarousal, where you're always on the alert for threats of danger, panic and anxiety attacks. And a lot of people have these symptoms after an abortion, and they don't understand that the abortion is what started it. Because abortion is considered health care. You should feel better, not worse. Any ambivalence about whether to have the abortion or not, ambivalence is a risk factor for trauma. We know this. And there's hardly a woman that wouldn't say that it's the most difficult decision I made in my life. It's precisely because of the ambivalence. Any previous psychiatric history is if you had depression or anxiety or another mental health disorder, there isn't a shred of data that shows that abortion improves women's mental health long term. And a lot of women who might be depressed, they often say that having a pregnancy gives them someone to live for. So the pregnancy, the joy of the baby can itself be healing, you know? So, but these are the risk factors for trauma. And once you've got the trauma, I mentioned the hypervigilance, anxiety and panic. There's also avoidance as another response where I can't talk about it, I don't want to think about it. And a lot of women go into an avoidance, and precisely to help them cope with the need to avoid and not think about it, then all the drugs and the alcohol, the pot smoking, and
it's
even
covering the pain.
Yeah. And then constriction is where you're trying to shut everything down. It's a numbing response. And suicide, of course, is the ultimate constriction. And we've done research on the people coming into Rachel's Vineyard, and we've learned that 60% of them had suicidal ideation thoughts, and about 20% actually had made suicide attempts. Yeah. So when we look at mental health issues in our culture, all the hospitalizations, all the different problems, it's really, really important to screen for abortion as an underlying trauma that needs to be addressed. Otherwise, people just spend their lives on drugs. You know, they're over-medicated, they're given antidepressants, anti-anxiety medication, and unfortunately, that usually comes along with a mental health diagnosis, and they're told that this is your problem, you're going to suffer this for life, you have a vulnerability, so go on these meds.
No one's talking about the abortion.
Nobody's going. And in fact, I know women that were hospitalized every year on the anniversary of their abortion. At that season of time, they would go into a deep depression, and they would say they would miss their baby. They would speak the problem, and they were all told, that's not your problem. It's something else.
Now, so isn't this ironic that some people are talking about abortion as this personal, private choice, as if it only impacts the woman who's choosing it? And here, what you're saying is the trauma created by abortion leads to, exacerbates, creates all these other problems that are very, very social and public. I mean, we're talking about suicidal behavior. We're talking about all kinds of other behaviors that can harm the individual or others. We're talking about health problems which burden the individual and the healthcare system. And all of a sudden, we're talking about the whole society.
And then the acting out.
And the acting out. This goes far beyond some kind of purely personal, private choice. And there's some other dimensions of that I want to go into in a little bit when we talk about all the other people that are affected. But on this question then of the trauma, so your study and your writing about abortion and the impact it has puts it in this category of trauma. And of particular interest in what you just said too is this avoidance. So a person, if they've experienced the trauma, then they're avoiding anything that's reminding them of it, right? Or that might recreate it in some way.
Yeah.
So we see such a societal avoidance of abortion, don't we?
We sure do.
And this is connected, isn't it?
Well, I think it is, and it's one of the reasons it's hard, as a priest to even talk about it in a church, because there's people in the pews who've suffered this loss, and they're just terrified to hear the word. If they even go to church at all, they will sit in the back so they can make a quick exit. Right. And that's the church. Then you look on the bigger level, where we just see the polarization of this issue and the absolute... when we talk about trauma, I said there's a fight, flight, fear, freeze, but there's a physiological response that accompanies trauma. We see it with soldiers, we see it with sexual abuse survivors. A physiological response means that it happens in their body because the trauma happened in their body. And so a lot of people will feel immediately sick to their stomach when they hear the word. Even if you're trying to hang in there and look normal, but there's a the anxiety that causes your heart to feel like it's ready to pound out of your chest, or your you feel like you're going to throw up because it really literally makes you sick, or other people get like a tremor. They feel like this is the physiology of trauma. It's really out of the person's control, and that's why you see sometimes a really aggressive, rageful response. That's the fight response. I'm going to fight you. I'm not going to feel what I feel. I'm not going to shift into where my body can like let go and begin to grieve. I'm going to defend myself, and I'm going to attack you. And I got to preserve. This is what we call survivor mode. Nobody's trying to be difficult. This is the truth. Their physiology is starting to like take over, and it demands a survivor response to get through it, to live through it, because that's how threatening this is. And the body feels it, and it goes on, and then you see all these reactions, or the acting out. And I like to say that every symptom tells a story, because the body doesn't lie, and the body tells the story.
Right.
So even if you're not aggressively fighting somebody, or you're in some cause, because there's many causes you can be angry and stay angry, this is what society gives us to act out the pain that people can't keep inside.
Yes, yes. Well, for those of you that are just joining us, we're with Dr. Theresa Burke, who founded Rachel's Vineyard Ministries, part of our family of ministries right here at Priest for Life. And we're at our Priest for Life studios talking about abortion as trauma. Many of the things that you're hearing, I'm sure you can relate to the things you see or experience, perhaps in conversations and relationships. Let's continue delving into this a little bit more deeply.